Hello everyone, welcome to this series of videos discussing the head and neck practical anatomy sessions. These videos are produced by the Faculty of Dentistry, University of Khartoum. This is Wathir Al-Fatih Idris, a teaching assistant for anatomy at the Department of Basic Medical Sciences, University of Khartoum Faculty of Dentistry. Our new session deals with various stations, the first of which will discuss the composition of the skull. The following will discuss the components or the contents of some of the contents of the infratemporal fossa that include the muscles of mastication, the internal maxillary artery, and the mandibular nerve. So let's go. Okay, in this station we are going to discuss the composition of the skull. I'm going to use the 5th edition of NETS flashcard for demonstration. As you can see here, this is a lateral view with a cut in the layers of the skull. The first layer, or the most superficial one here, the beige one, is known as the skin, is the first layer, and this is the skin. The skin of the scalp is the thickest skin in the body, being the thickest in the occipital region. This skin is characterized by being by containing a lot of hair. It is the hairiest skin in the body, and also it contains a high proportion of sebaceous glands. This skin also receives some of the fibers of the muscles that form other parts or other layers of the skull. The second layer, the layer that lies beneath it, yellow colored here in this section, this is the subcutaneous connective tissue. The subcutaneous connective tissue contains blood vessels and nerves that supply the skull. Also, it gives a way for connective tissue running from the third layer to connect with the first layer or the skin. Deep to this layer, we have got this layer, which is the third layer, and this layer is composed of a muscle and dense fibrous connective tissue. The muscle is known as the occipitofrontalis muscle, or that is composed of two bellies, an anterior belly known as the frontal belly, and a posterior one, which is the occipital belly of occipitofrontalis, with an intervening aponeurosis in the middle. This aponeurosis is known as the epicranial aponeurosis or the gallia aponeurotica. Let's discuss the occipitofrontalis muscle. The occipital belly originates from the highest nuchal line here posteriorly, and then the fibers ascend and pass forward, upwards and forward, to be inserted into the posterior border of the gallia. The two occipital bellies on the right and the left sides are separated in the midline here by a strip of aponeurosis that is attached to the exuberance, as well as the medial part of the highest nuchal line. From one frontal belly originates from the anterior border of the gallia aponeurotica, and that the fibers pass downward and forward and downward to be inserted into the upper border of this muscle, which is known as the orbicularis oculi, one of the muscles of facial expression, and also into the skin of the eyebrows. The gallia aponeurotica itself overlies the cranial vault and extends laterally as far downward as the ear and the upper border of the zygomatic arch. On its way downward, it blends with the superficial temporal fascia or the temporal parietal fascia, extending downward on the deep temporal fascia to reach the zygomatic arch and the ear. This is for the third layer of the skull. Deep to the gallia aponeurotica and the occipitofrontalis muscle is a minimal amount of loose connective tissue. This loose connective tissue provides a potential space or a plane over which the upper layers of the skull can be moved on. Deep to this subaponeurotic space, we have got the fifth layer of the skull, which is formed of the periosteum of the bones of the cranial vault, and it's known, hence its name, the pericranium. The pericranium is loosely attached to the bones, however it's very densely or firmly attached to the suture that unite these bones together. So the 5 layers of the skull can be recalled from the letters forming it. The S is for the skin, the most superficial one. The C for the connective tissue, the subcutaneous connective tissue. And then we have the A for the aponeurosis, the epicranial aponeurosis. Following it is the L for the loose connective tissue or the subaponeurotic space. And the 5th is the P, the pericranium or the periosteum of the cranial vault. Now let's move to see these layers in the cadaver. Here in the first specimen, we can barely see the 5 layers of the skull clearly. The outermost layer is this dark layer, the skin. As I've said, the skin of the skull is the thickest of the body, the thickest skin of the body, and being very thick in the posterior region or the occipital region, it is the hairiest part. It also contains a high proportion of sebaceous glands and receives the insertion of the some of the fibers, muscle fibers of the skull. Deep to this layer, we have got the subcutaneous connective tissue here. The subcutaneous connective tissue contains the blood vessels and the nerves that supply the skull. The 3rd layer, okay, here is a part of the 3rd layer, is composed of the gallia aponeurotica here in the midline, while anteriorly we have the frontal belly of occipiter frontalis, emerging from the upper border or being attached to the upper part of the orbicularis oculi muscle, extending backward to be inserted into the gallia aponeurotica, while posteriorly here we have the occipital belly of occipiter frontalis muscle. Deep to this, we have got loose connective tissue here. Very minimal amount of loose connective tissue, as we can see here. This provides a potential space or a plane known as the subaponeurotic space, over which the upper 3 layers of the skull can be moved on the skull. Deep to the loose connective tissue, we can see the periosteum of the cranial bones or the cranial vault. Okay, this periosteum is known as the pericranium. It is loosely attached to the underlying bones that can easily be stripped off. However, it is very densely attached to the sutures that unite these bones together. So these are the 5 layers: skin, subcutaneous connective tissue, gallia aponeurotica with the occipital frontalis muscle, loose connective tissue, and finally we have got the pericranium. That's all for the skull. The second station deals with discussing a group of muscles that are concerned with movement of the lower jaw. These are known as the muscles of mastication. They are 4. The first of these is the temporalis muscle, the one that can be seen here in this flashcard. The temporalis muscle, as you can see here, originates from the side wall of the skull, from the temporal fossa, from the whole area below the inferior temporal line. It's fan-shaped. The anterior fibers are almost vertical, while the posterior fibers become gradually horizontal. Okay, they extend downward and forward beneath the zygomatic arch, being transformed into a tendon that is inserted into the medial surface of the cornoid process near its anterior posterior borders and its apex. The muscle is very strong, and the anterior fibers usually are primarily concerned with elevating the jaw, while the more posterior fibers are concerned with retracting the jaw from its protracted position. Now we're going to move to the second muscle. The second muscle is the masseter. The masseter is the strongest muscle in the body. It originates from the inferior border of the zygomatic arch and extends downward and backward at a 45-degree slant to be inserted into the whole of the lateral surface of the premise of the mandible. The most posterior fibers that are seen here originate from the deep surface of the zygomatic arch and extend almost vertically downward to be inserted into the upper part of the mandibular ramus, and these fibers blend with those of the temporalis muscle. The pull of this muscle is upwards, forward, and somewhat medially, so it assists in closing the jaw. The third muscle is the medial, and the fourth is the lateral pterygoid. So let's see them. The lateral pterygoid muscle is this muscle here. This muscle has got two heads. It has got an upper head and a lower head. The upper head originates from the roof of the infratemporal fossa, that is to say, the infratemporal surface of the squamous part of the temporal bone and the greater wing of the sphenoid bone. While the lower head originates from the lateral surface of the lateral pterygoid plate. The two muscles lie edge to edge. They pass backwards and laterally to be inserted into the pterygoid fovea located on the anterior surface of the neck of the mandible, and some of the fibers are inserted into the capsule and the articular disc of the temporomandibular joint. When this muscle contracts, it pulls on the mandibular neck as well as, or the condyle, as well as the articular disc and the capsule. So it draws these structures forward from the mandibular fossa here down the slope of the articular eminence. So it assists in opening the mouth. It is indispensable to the opening of the jaw. The fourth muscle is the medial pterygoid muscle. This medial pterygoid muscle has got also two heads. They are unequal in size. There is a superficial head, this is a small one, and a deep head. The deep head originates from the same lateral pterygoid plate, however, from its medial surface. So it originates from the medial surface of the lateral pterygoid plate, while the superficial head originates from the maxillary tuberosity and the pyramidal process of the palatine bone. The two heads clasp the inferior border of the lower head of the lateral pterygoid muscle, and they pass downward, backward, and laterally at a 45-degree slope to be inserted into the inner aspect of the angle of the mandible. So when it contracts, it pulls the angle of the mandible upward, forward, and medially, so it helps in closing the jaw. It also participates in the side-to-side movement of the jaw, as well as protracting the jaw when it contracts with its fellow of the opposite side and with the two lateral pterygoid muscles. These are the four muscles of mastication: the temporalis, the masseter, the median, and the lateral pterygoids. Now we're going to move to see them on the specimen. Here is a quick look of the at the muscles of mastication. This is the temporalis muscle, the fan-shaped muscle being covered by the deep temporal fascia. It originates from the whole temporal fossa as well as from the deep surface of the deep temporal fascia. It passes downward and forward to be inserted into the coronoid process of the mandible. Okay, this is the masseter. Okay, the masseter originates from the zygomatic arch that is being cut and extends downward and backward to be inserted into the whole of the lateral surface of the mandibular ramus, which is also being cut. The third muscle here, which is composed of an upper head, and this is the lower head of the lateral pterygoid muscle. The lower head, which originates from the lateral surface of the lateral pterygoid plate, and the upper head, which originates from the roof of the infratemporal fossa. Both pass laterally to be inserted into the condyle as well as the articular disc of the temporomandibular joint. The fourth and the final is this muscle. This is the medial pterygoid, diverging at right angle from the lateral pterygoid muscle. This is the medial pterygoid. It's characterized by these glistening tendinous intersection passing downward and backward to be inserted into the inner aspect of the angle of the mandible. That's all for what can be seen of the muscles of mastication at the specimen. The third station is concerned with discussing the mandibular nerve. The mandibular division or the mandibular branch from the trigeminal ganglion within the middle cranial fossa passes lateral to the cavernous sinus, and then it exits the cranial cavity by passing through the foramen ovale, together with the motor root of the trigeminal nerve. The mandibular branch and the motor root unite within the foramen ovale to form the mandibular nerve trunk. Okay, this mandibular nerve trunk, as it passes through the foramen ovale, it finds itself within the infratemporal fossa. It has got a short course and it gives only to two branches. The first one here we can see is a sensory nerve. This is known as the nervus spinosus. The nervus spinosus enters the cranial cavity through the foramen spinosum, or sometimes through the foramen ovale itself, and it goes into the middle cranial fossa to supply the meninges of the middle cranial fossa and the mastoid air cells. The second branch from the mandibular nerve trunk is the nerve to medial pterygoid, the nerve that supplies the medial pterygoid muscle. It cannot be seen here in this view. It supplies the muscle, and also it gives a branch that passes through the optic ganglion without relay to supply the tensor palati and the tensor tympani muscles. After which the mandibular nerve then divides into two divisions: a large posterior division and a small anterior division. The anterior division gives muscular branches to the muscles, to the four muscles of mastication. In addition, it also gives a branch that supplies the skin of the cheek as well as the mucous membrane, and gives proprioceptive or sensory fibers to the buccinator muscle. So the five branches, all of them are motor, with an exception of the buccal nerve. These branches are temporal branches to the temporalis muscle, lateral pterygoid, nerve to the lateral pterygoid, and the nerve to the masseter or the masseteric nerve. The fifth one is the branch to the long buccal branch that passes downward and forward on the surface of the buccinator muscle. It supplies the skin of the cheek, and then it pierces the maxillator muscle to supply the mucous membrane of the cheek, as well as the gingiva opposite the mandibular molars and second premolar. The posterior division, this large division, it gives rise to three large branches. These branches are sensory. The first one is the auriculotemporal nerve, this nerve, which originates by two roots. The two roots surround this vessel, which is the middle meningeal artery, and it passes backwards deep to the neck of the mandible, and then it crosses the zygomatic arch behind the superficial temporal vessels to supply the auricle and the temporal region. It divides into two branches, an auricular branch and a temporal branch. The auricular branch supplies the skin overlying the tragus of the ear and the lateral aspect of the upper half of the ear pinna, as well as the external acoustic meatus and the external surface of the tympanic membrane, while the temporal branch supplies the skin of the temporal region. It also gives a branch that enters the parotid gland. It carries parasympathetic secretory motor fibers from the optic ganglion. The second is the inferior alveolar nerve. This nerve extends downwards towards the foramen, towards the mandibular foramen, running within the mandibular canal. Before it enters the mandibular foramen, it gives off a small branch. This is known as the nerve to mylohyoid. This nerve is motor. It runs downward on the surface of the mylohyoid muscle, supplies the mylohyoid muscle as well as the anterior belly of digastric. It also carries sensory innervation to the submental skin and sometimes to the mandibular incisors. The third branch from this division is the lingual nerve. Okay, this is the lingual nerve, accompanied or joined by the chorda tympani. It descends downwards over the medial pterygoid muscle and passes medial or anterior to the inferior alveolar nerve to supply the mucous membrane of the oral, mucous membrane of the floor of the oral cavity, as well as the lingual gingiva and the tongue itself with general sensation. So the three branches that emerge from the posterior division are the orbiculotemporal, the inferior alveolar, and the lingual nerves, while the branches that originate from the anterior division are two deep temporal nerves, mesenteric nerve, nerve to lateral pterygoid, and the fifth is the long buccal nerve. That's all about the mandibular nerve. We're going to see only the inferior alveolar nerve in the fresh specimen. The mandibular nerve cannot be seen in this cadaver because it lies deep to the lateral pterygoid muscle. Only some of the branches that emerge from beneath the lateral pterygoid muscle can be seen. Between the upper and the lower heads of the lateral pterygoid, one can see the buccal branch, the long buccal branch, from the anterior division of the mandibular, seen heading towards the cheek. Okay. Also, emerging beyond the lower border of the lower head of the lateral pterygoid are these two branches. This one, which is heading towards the mandibular canal within the ramus towards the body of the mandible, is the inferior alveolar nerve. Lying anterior to it, also emerging below the lower border of the lateral pterygoid, is the lingual nerve, which is seen going anteriorly forward, being joined by this small branch, which is the chorda tympani branch of the fascia from posteriorly. These are all of the branches of the mandibular division can be seen here. Here is the last station that is concerned with the internal maxillary artery. The internal maxillary artery and the superficial temporal artery are the two temporal. These are the two terminal branches of the external carotid artery. The internal maxillary artery passes forward deep to the neck of the mandible. It enters the infratemporal fossa, and then it runs in the usually deep to the lateral pterygoid muscle, sometimes superficial to it, and after which it passes through the pterygomaxillary fissure to enter the pterygopalatine fossa. It is being divided into three parts by the lateral pterygoid muscle. The first part is the part that lies before the muscle. The second part is the one that lies on or deep to the muscle, and the third part is the part that lies beyond the muscle. Each of the three parts of the maxillary artery gives rise to 5 branches. The first and the third branches of the first and the third parts go into bony foramina, while those of the second part are muscular branches that pass to supply muscles in this region. Branches originating from the first part of the artery, as I've said, they are 5, and these are 2 branches that pass towards the ear. These are the deep orbicular artery and the anterior tympanic artery. The deep orbicular artery passes between the bony and the cartilaginous part of the external acoustic meatus. It supplies the meatus itself, while the anterior tympanic, it enters through the petrotympanic fissure. It finds itself within the middle ear. It joins the circular anastomosis around the tympanic membrane. These are 2. The third one is the branch that emanates from its inferior aspect. This one, this is small or tiny branch. It descends downward and forward to enter the mandibular foramen. This is the inferior alveolar artery, accompanied by its vein posteriorly. This branch enters the mandibular foramen and runs within the mandibular canal to supply the pulse of the mandibular molars and premolars. Then it divides, as well as the body of the mandible. Then it divides into 2 branches, the incisive and the mental. The incisive continues forward within the canal to supply the pulse of mandibular anterior teeth, while the mental exits through the mental foramen in the mandible to supply the chin and the lip the lower lip. The fourth one is this one that passes upwards, is the middle meningeal artery. The middle meningeal artery passes upwards, being clasped between the two roots of the orbicular-temporal nerve. It enters the cranial cavity by passing through the foramen spinosum. Once in the middle cranial cavity, the cavity of the middle cranial fossa, it passes laterally, and then it passes upwards and forwards into the inner aspect of the greater wing of this fluid, where it divides into anterior and posterior division. The middle meningeal artery is directed primarily for the supply of the bones of the skull, or the bones of this cranial vault, because they receive minimal blood supply from the vessels of the skull. The fifth branch is also originates from the upper aspect of the artery. This is a small branch that passes upwards. It enters through the foramen oval, that is known as the accessory meningeal artery. This accessory meningeal artery enters the middle cranial fossa. It supplies the meninges of the floor of the middle cranial fossa, as well as the mecals, or the trigeminal cave, and the trigeminal ganglia. So the five branches that originate from the first part are the deep orbicular, anterior tympanic, inferior alveolar, middle meningeal, and accessory meningeal arteries. Branches of the second part are muscular. They are directed mainly to the muscles of mastication. We have got mesenteric artery, we have got pterygoid branches to the medial and lateral pterygoid. We have got two deep temporal branches that pass upwards deep to the temporalis muscle, supplying it from its deep aspect. And also we have got a buccal branch that descends downwards on the surface of the buccinator muscle. The branches that emerge from the third division, or the third part of the maxillary artery, accompany branches of the maxillary nerve and the pterygopalatine fossa. These are this one, the largest one here, that passes upwards through here through this foramen. This is known as the sphenopalatine foramen. Is the sphenopalatine artery that passes upwards and forward in order to supply, it enters the nasal cavity to supply the nasal walls. Okay. The second one here, which descends downward, is the greater palatine artery. This greater palatine artery gives also another branch, which is known as the lesser palatine artery, that supplies the soft palate. The greater palatine artery itself supplies the hard palate, passes forward, supplies the hard palate, and then it passes through the incisive foramen and the incisive canal and enters the nasal cavity, also participate to the supply of the walls of the nasal cavity. This branch that is directed to the posterior wall of the maxilla is known as the posterior superior alveolar, which usually splits into 2 or 3 branches that pierce or enter through foramina in the posterior wall of the maxilla. These posterior superior alveolar branches supply the pulse maxillary molars. The other two are very small branches. The posterior of these is the artery to the pterygoid canal, and the anterior one is the pharyngeal artery that passes through the palato-vaginal canal. So all of the five branches that originate from the third part are the sphenopalatine artery, the pharyngeal, the artery of the pterygoid canal, the posterior superior alveolar nerves, and the greater alveolar arteries and the greater palatine artery. The termination of the maxillary artery then passes upwards. It passes upwards through the infraorbital fissure into the orbital cavity running within the infraorbital groove in the infraorbital canal, in the orbital floor, being transformed into the infraorbital artery. The infraorbital artery then exits the orbital cavity by passing through the infraorbital foramen to reach the face, where it supplies the lower eyelid, the side of the nose, and the upper lip. So these are all of the branches of the maxillary artery: 5 from the first, 5 from the second, and 5 from the third, and it continues as the infraorbital artery that supplies the face. Now we're going to see the maxillary artery in the fresh specimen. The internal maxillary artery is one of the, as I've said, is one of the two terminal branches of the external carotid artery. It emerges within the parotid gland. It gives rise, it emerges within the parotid gland together with its other terminal branch, the superficial temporal artery, which passes upwards in the temporal region. This maxillary artery, this is the artery which is dark here in color because it lies close to the pterygoid venous plexus. It passes forward into the infratemporal fossa, deep to the neck of the mandible. It lies usually deep to the lateral pterygoid muscle. However, in this instance, it lies superficial to the muscle. It has been divided, as I've said, into three parts. The part that lies before the lateral pterygoid muscle is the first part. The part that lies on the lateral pterygoid muscle is the second part. And the third part is the part that lies beyond the lateral pterygoid muscle. The first part gives rise to, each part gives rise to 5 branches. However, those that are seen here from the first part is the inferior alveolar or the inferior alveolar artery that passes downward, accompanying the inferior alveolar nerve to enter the mandibular foramen. Okay, these superior branches pass backward and laterally towards the ear. These are probably the deep auricular and the anterior tympanic branches, and this large branch which passes upwards might be or most probably is the middle meningeal artery. Okay, it gives the second part gives a number of muscular branches that supply the muscles of mastication as well as the buccinator muscle. One of them is evident here. It reaches the deep surface of the temporalis muscle from below. This is the temporal branch from the maxillary artery, and the third part cannot be seen because it passes through the pterygomaxillary fissure to enter the pterygopalatine fossa. So that's all what can be seen from the maxillary artery and its branches. Lying below the maxillary artery is the maxillary nerve, which receives the pterygoid venous plexus, a network of venous channels that surround or might be found within the lateral pterygoid muscle and drain into the maxillary vein. That's all for the maxillary. That's all for the maxillary artery, and now our practical have come to an end. So see you in the next session.